talk about babies when they first come out. For those of you who have been doing this forever, I apologize with all my heart because I know this is a very big review for you. I mean, not a review. I mean, you could teach this and teach me. I've only been in birth work for a little over 30 years, and I know there are people here that are much further along that path than I am. Oh, there also was language in the new NRP guidelines about, it was more specific about if the baby is breathing and crying, you don't have to suction the baby. I was like, oh, imagine that. They know how to clear their own airway.
The last one said suction if necessary.
Right, but it's even more, the verbiage when I read it, it was even more encouraging or more discouraging of suctioning. It sounded better. I was trying to have a talk with one of our residents the other day, and she was like, why don't you want the bulb suction? I'm like, because we don't need it. The baby's pink and crying. And she's like, but you need to suction the baby. I'm like, no, you don't. Did you know that the doctors, they don't have to have NRP? Because all they have to do is hit the button on the wall. Because the nurses have it, and because the pediatricians have it. So therefore, the doctors, the OBs, they don't have it. They don't do NRP. I know.
But they're looked at as the one.
Now, if you worked in a community hospital, some of them require it because they don't have an NICU and they don't have people to run and help. You know. All right.
Wow.
So let's talk a little bit about what we want to know in advance before a baby comes, right? To anticipate any kind of challenges that you might have with a newborn baby. So we have antepartum risk factors, right? So what are some of those things like before a woman goes into labor that we're looking for?
GBS.
GBS status is one of those.
If she's a smoker.
Okay, that's a good one. So lifestyle factors, right? Okay.
Weeks.
Their gestational age, right? Earlier, later spectrum, right?
Gestational diabetes.
Does she have gestational diabetes? Pardon? Preeclampsia, any hypertensive disorders, right? Even those gals with white coat hypertension, guys, they can bleed like a stuck hog. I'm just telling you. Because if they're spiking those temperatures, or those responses, they're spiking those blood pressures when they're coming in to see you because they're nervous while you're taking their blood pressure, they also can do that because they're stressed by labor. And then they have a hypertensive disorder. And it affects their placenta, just like having gestational hypertension or later on preeclampsia. So think about it. I know, we never thought about it that way before. But there's more and more attention towards they really do have hypertension, right? So it's interesting, I think. What else? Any other thoughts? If they've had a scan and you know that they have a marginal cord insertion, I know that y'all are not ones who are out there yanking and pulling on the cord, but that is a thing. Cord traction, we would want to be careful with that, right? If we were trying to get a placenta born. Any other thoughts?
Is neck-stained fluid still a risk factor?
Yeah, more fluid or low fluid or meconium stained fluid. So if somebody's 41 and a half weeks and they have fluid that has, it looks like Gatorade, lemon lime Gatorade, right? There used to be this differentiation between that and if they have chunky, particulate, thick neck. Now there's sort of like some questioning of that. It's like meconium's meconium. They've been swimming around in it anyway. So what's your baby going to do? A lot of our old regulations were written where if somebody has thick, particulate meconium and they are remote from birth. And so what did we always do? Was just like, don't break their water. We don't want to know. Because for a lot of reasons, but still, I'm joking but not joking, as y'all know. So anyway, so let's talk about labor risk factors, right? So what in labor starts getting your pink flag up? And then, we get to red flag later. What's some of the things that you... Heart tones. Are they having little dips in the baby's heartbeat, right?
So labor slow progression.
Yes, absolutely. Or prolonged pushing, and they have to push a real long time to get that baby born for whatever reason. Whether it's slow descent. Any other thoughts? Of course, when the baby's born, if you have shoulder dystocia, right? that that baby is more likely to struggle a little bit when they first get out.
Abnormal bleeding.
Yes, abnormal bleeding, which could be from a multitude of things. If you've practiced a long time, you've seen weird bleeding things, right? The weirdest one I ever had was a gal in the tub that she would have a contraction and she would have a spurt of bright red blood. And then it would stop when the contraction was over. And then it would go again. And so she was a multip. She was progressing quickly. I'm thinking, I wonder if she has like an erosion in a vessel in her cervix or something. What is going on? I got her out of the tub. And then by then she was pushing. So I was like, okay, well, I guess we're okay. Because baby's heart tones were fine. Baby came out pale, limp. And she had had a velamentous cord insertion that was not diagnosed, and there was blood all between the two layers of the amnion and everything, and there was clots in there, so the baby had been bleeding for a while.
Oh, no.
So you never know what you're gonna find, right? That's one of the things it's not predictable. So we had somebody not too long ago that has been having a lot of bleeding during their pregnancy. And she has a big, bulgy, and almost like a hemorrhoid kind of thing on her cervix itself. So there's weird stuff, anatomy-wise. We're all built very differently, right? So we don't really know.
Is it for the vein on the cervix?
No, it's not a polyp. It's actually a blood vessel in the cervix itself that is bulging and bleeds every once in a while.
Right.
Just like a varicose.
No.
Varicosity?
It's a varicosity of some sort that's unusual.
Yeah.
So, people have weird stuff in their bodies. We are all different people, right? So those are just some things to be aware of, obviously, is that if your pink flag starts going up about anything, make sure that you have all your stuff ready, right? And I know y'all do that anyway, but the other thing is we live in a climate in which it is hot and cold. Check your equipment on a regular basis, because it will melt and it will freeze and things will malfunction, and you should have a backup for everything, okay? That's another thing to think about. And I know it's expensive to do that, but and also bring your bags in when it's real hot outside or real cold outside. I know that, like I said, those of you who've been practicing a long time, it's not rocket science, but it bears mentioning. Because I have pulled out a bag before and the mask was melted, and you're like, oh gosh, I'm glad I have another one, because if I didn't, I'd be hosed. All right, so let's just talk about babies born, right? Out comes the baby, oh, my baby's here, and your mama's sitting there in the tub, and she's like, oh, I love my baby, and you're like, okay, well, let's just see if your baby's okay, or let's look at your beautiful baby. Can we see your baby's face? And you lean the baby out, and the baby's breathing or crying. The baby, how do we know the baby's okay? How do you know in a dark room or in a substandard condition where it's hard for you to see what's going on? How do you know your baby's okay? What are the things that you check?
Good tone.
Right? Tone is big, right? What else?
Alertness. Just
Right.
Looking around.
Is the baby looking like it's here?
Yeah.
For lack of a better term, right? All right. One of the other things, if you are a cord palpator, those of you who reach your hand in and just palpate the cord, got a good heartbeat, things are good. That's another one. So one of the things that my friend Julie taught me that I had never thought about, I always think about, I know things that may be very obvious to other people, but they were not obvious to me, is sometimes just moving a baby into just a different position allows that other lung to expand. Like if you've got a baby that's like this and baby's not really as vigorous as you think you want, you're like, oh, let's just switch your baby to this side. And then it allows that other lung to expand, right? So just small position changes can sometimes let you know, is this baby okay? You're rubbing the baby's foot or talking to the baby going, hey baby. All right, if your baby is not okay, and your baby's not okay, what are some of the steps that you guys take? Like how do you resuscitate or make sure that you can help these babies breathe? What is your first, it depends on the position where your mama's at, where did she birth. She's on her hands and knees. She's in the tub. Have you ever resuscitated a baby up on her back? Yeah, I have too. If you lay them like this and their head is down and it fits along the curve of her booty that way, it's a really nice extension of the head to be able to give a baby some breaths. Some people carry a cookie sheet and they use it, underneath somebody's butts in case they need to suture. But also it works nicely if you need to sit the cookie sheet right on the edge of the tub or wherever you are to have a good flat surface, right?
I haven't had to do it, but they say the resuscitator floats.
I have not had to resuscitate a baby in it, but I have played with it. I know they're expensive.
Oh,
But
yeah.
boy, they're amazing. They keep that baby in,
Yeah.
and they can transport the baby, if you do have to transport a baby in that resuscitation cradle.
Yep.
I think that if I were attending home births again, I totally would buy one.
What is it?
Oh, I got resuscitator.
So, those gardening rehab things that you put on the ground that are coated in plastic, they have one that's formed for a baby.
Yes.
And it has a support for the neck, so the neck is just slightly in that sniffing position. And it sort of hugs the baby in all the right places.
It's at the Airbnb.
But it also has like where they can strap it into like the gurney and stuff.
Mine comes with straps that are attached.
But when we're done.
Yes, they're pretty cool. So position really matters, right, when you're trying to help a baby breathe. NRP does say that if you are going to give positive pressure ventilation or you're going to ventilate your baby, that you're supposed to suction first, no matter what, okay? That was not, in some of the past, it was in the 8th edition, but before that, they didn't always specify that. I think they just assumed. They just assumed everybody was suctioning their babies, which for us, we're like, no.
Responding, I would think that would be something you would do first.
Right, and that is something that's why they do recommend that. What do you guys use for suction? Talk to me about the different types of equipment or techniques that you have that you're using now. Of course, all right, so we got bulb syringes, right?
I have a Delee.
Right, the Rescue Vac, isn't that the name? I love that one. Yeah, Rescue Vac is nice because it doesn't require any power. You just,
They're nice.
yeah, it has a little trigger on it.
Yeah.
They're lovely. This is one of the old-fashioned suck it with your mouth Delees, right? For deep suctioning. What if mom had an abruption and she's got lots of blood clots and stuff? Do you think a Delee will pull the blood clots out? Not if they have a great big clot in there. So another option is to buy an ET tube. These are the ones that are used for intubation. They have these now, and you can put this on your suction and use it as a suction cannula because it's thicker. It's another idea. And they have those meconium suction barrels. They have like where you can touch it. It's a connector and it's plastic, and I don't know why mine's not in my bag right now, but anyway, you touch it and then you hold it and pull it out. Let me show you the other. Similar to this, but it's bigger.
That's what's on the Rescue Vac.
Right.
Okay.
So this is just a regular suction catheter, right? That if you are needing to really deep suction your baby, that's what it looks like. And you put it down in there, and then this one actually, you can convert this for either tubing or you can actually use your mouth for it. Either one, okay? Without having to have any mechanical, devices. So those are just some options. Having a suction catheter of some sort in your bag is nice because you can suction through a laryngeal mask airway. It's not something I ever thought about, but it will go down the middle of it, okay? So you probably could use a Delee too, depending on the tubing size that you use, right? The French of the catheter. Okay. And if we're going to need to give a baby some breaths, I know everybody's got all different kinds of. This is the one I use when I'm demonstrating for people to take NRP the first time. This came out of my birth bag. That one's not going to work, is it? All right. So when you buy a bag and mask valve, when you buy these, you have no idea what you're going to get. It's funny, the picture does not always match what you get when you order them from the suppliers. It's whatever they have sometimes. I do recommend that you have both a bigger mask and a smaller mask at a minimum. So these are the little tiny ones for the little itty bitty babies with the little small faces that sometimes pop out that you didn't know that they were that small. And then of course the newborn size is this one, right? Some of them have a port that you can inflate to make sure that it's nice and cushy and it'll form to the baby's face. We do really recommend that you have a bag and mask that has a valve on it that will show you the pressure that you're using. Some of them do and some of them don't, okay? So you also want to make sure your pop-off valve works. So this is your pop-off valve here. And you want to make sure that if you seal it, that you see that it pops the pressure off, because you don't want to cause your baby to get a hole in their lung or a pneumothorax, right? But you want to make sure, some of them have a way that you can, like, this one plugs it. Don't ever plug it. I don't know even why they put those on there. It's ridiculous. Because you don't want to do it where these pop off at 40 millimeters. So we want to stay below that anyway. All right, so here's where we're talking about with giving your baby rescue breaths. They changed the recommendations now from 40 to 60 breaths per minute. And the reason they're saying is we figured out that if you breathe a little faster, it might be beneficial. You think? And one I just use, and I do this in my sleep sometimes, I'll go, breathe, baby, breathe, baby, breathe, baby, breathe, baby, breathe. And you can actually time yourself on using the right rescue breath. Because you know when you're panicking, it is one of those things where you can't count. So you want to practice, you want to drill with yourself. Breathe, baby, breathe, baby, breathe, baby, breathe, baby. We got a letter from someone that was a community birth worker who said that she had had a successful, really good resuscitation of her baby, and her whole team was going, breathe, baby, breathe, baby. And the daddy wrote a letter to them and said, I heard you telling my baby to breathe, and I knew that everything was going to be okay. And I was like, oh my gosh, people see what you do and they hear what you say, right? We all know that. But it was just kind of like, to him it was encouraging, because when people are like, oh, you don't want to say anything out loud. Well, why not? I mean, they know their baby's in trouble. That's the other thing. It always makes me laugh. They know. You're not doing anything that they don't know. They know something's going on. All right, if you're trying to check a baby's heart rate, how hard is it to hear in a chaotic room? Really, really hard. One of the tools that you can, the algorithms will tell you, consider a cardiac monitor. They're expensive. That's another piece of equipment. Almost none of us have them, right? But you do have a Doppler. Most of us use Dopplers. Not everybody does, but most do. You can put gel on there and put it right here and turn the volume up, and you can hear a baby's heartbeat. When you first if your baby's heart rate is 40 or below, and sometimes even 60 or below, it won't pick up with your pulse ox. So if it's not picking up your baby's heartbeat, and you can't hear it, you don't know what it is. So this is an it's like a microphone, right? It's an amplification device that helps. So these are just little hints and tips that might be a little bit different. So we're breathing for the baby, we're checking the baby's heart rate, we're seeing, is the baby's heart rate, how's it doing? Does the baby just need help breathing, or is the baby gonna need some extra help, right? So you're watching for chest rise. What if the chest isn't rising? What do we do next? Okay, so the Mr. SOPA, we don't like Mr. in anything, we call it Mrs. OPA. So Mrs. OPA, first it's mask, right? Check your mask. A lot of the times we're just not putting enough pressure on the baby's face, believe it or not, because we're afraid we're gonna hurt them, or, we're in an awkward position, right? So mask, reposition, okay, you wanna make sure their mouth is open, right? And so suction is the S, right? O, open the airway, right? Another mistake that people make is by putting their finger underneath the baby's chin instead of on the chin. So just kind of pay attention to where your fingers are. So you want to kind of push down on the baby's chin and the bridge of the nose to seal, and then pull it up, okay?
I have a question.
Yeah.
Now, would the laryngeal mask prevent the need for all of
Yes,
that?
that's
So
the
does
key.
the laryngeal mask get rid of Mr. Sofa?
It gets rid of the need for Mr. Sofa much of the time, unless they have like a mucus plug that's
Yeah.
really thick or something like that. All right, so I'm going to pass these around so you can see what they look like. For those of you who don't know what these are, now there are a lot of different brands. There's a lot of different kinds. The old-fashioned ones, you have to actually inflate this cuff around it, but the new ones you don't. These are the eye gels. With an eye gel for a normal term baby of any size, pretty much you only need one size, okay? These, I'm going to pass them around. You guys can play with them. They come in a case, so they're sterile. The green part on them, the green part on them is heat sensitive, so once it's down in there, it kind of forms to the anatomy of the baby. So, if you guys want to pass those around, if those of you who haven't seen them, and one of the nice things about them is they're just easy to handle. Here's one that is not the same. That's an old-fashioned one.
Are you saying this number one is the one?
The number one size is good for all of the babies. It's good for any range of baby we're going to be using. So now, let me just show you all a little bit about when you insert these. Okay, so you're suctioning your baby, right? You're doing that first. The easiest way to remember these is how you put them in. Your baby is limp. Your baby is not causing resistance. Your baby is not breathing. You want to go with the baby's anatomy. So the curve of, I always remember the palate is curved, and you want the hole to go down to their lungs, right? So you just put your baby like this, you insert it, and you just insert it until it stops. Most babies that are newborns are wet, so you don't have to lubricate it, you don't have to do anything. If you feel like you need to lubricate it, it's fine. Use some sterile saline. It goes usually down about that far. But you just push it till you get resistance because it won't go too far. Because it hits right, above, it's in that supraglottic area. It's a blind sac, it won't go anywhere else. Now, the other part about that, and so when you get that in, this one I can't intubate into this one, or not intubate, but I can't do. Then you take the mask off of your bag and mask and look. And it's already in there.
That is so cool.
It's very cool. So I would encourage everybody, if you don't do anything different, you can actually use your mouth even to inflate on an eye gel, okay? If you have a malfunction of your bag or whatever, just remember always to watch only for chest rise. You don't want to just blow real hard. They're pretty cool. So that was called an eye gel, I-G-E-L, and it is a laryngeal mask airway, or LMA. Now, this class is about over. But I want to show you something else that we teach in our class, and it is something to think about carrying. And this is one of the gauges that tells you, you can buy the individual gauges to go if yours does not have one, and you attach it and it tells you how hard you're breathing for your baby, okay? So you can buy just the gauge from some of the midwifery suppliers. Do you guys, how many people carry oxygen or compressed air? Okay. Oh, nobody cares. Got it. Okay. Good God, I swear. Yeah, isn't that crazy? So now the other thing there, we are supposed to start a resuscitation with 21% oxygen, which is room air, right? So if your baby is significantly depressed and you need to turn up the oxygen because you're going to start compressions on your baby, or their oxygen saturation doesn't meet the guidelines of where you're supposed to be, they're recommending people carry compressed air to run these. This is a T-piece resuscitator. And if you guys decide to have us come and teach for you, we'll teach you how to use it. They're cheap. It's like 20 bucks. But then what's expensive is finding the compressed air sources for them and being able to get access, because a lot of people struggle. People usually can find oxygen quicker than they can find compressed air.
Right.
Oh.
It's in a tank, just like oxygen is. All right, the other piece that I would encourage everybody to have, of course, is a pulse ox, right? So anytime you're gonna do more than just 3 or 4 breaths of PPV, you're gonna want to go ahead and put a pulse ox on. Let's see what our baby's oxygen level is, right? This is a Massimo, it's an old one, it's a good one. But I wanted to tell you what I learned from the Massimo rep that would have made my life a lot easier 10 years ago. They do recommend that you put these on the baby's right arm and have the wire go towards their heart. They said it will pick up sooner that way. So you put it on with whatever kind of probe you have on it, and you don't turn it on till you have it on there, and then you turn it on. And they say that it will capture a lot faster and do better. Because I don't know how many of you guys have been sitting there going, what? You know, it doesn't, I mean, it's happened to me a bunch of times.
No,
Yes,
that's,
yes.
that's a good tip.
So it's just another little tip to make your life
So
easier.
put it on first
And then turn it on and make sure that the wire is going up towards the heart and on the right hand.
Okay.
Right hand,
Yeah.
wire towards the heart, and then turn it on, okay?
So you know, they have that grip. Can you do the wrist? Because sometimes I do the
Yeah,
wrist.
you can do the wrist, but just this right
The right,
appendage, yes, the right is better.
Right.
Yeah, and I've had better luck with the wrist
Right.
sometimes than their hand. All right, so we're out of time. Does anybody have any quick questions before you guys move on to your next person?
Were you in hurricane police?
Pardon?
Were you there for the hurricane?
Yes, ma'am.
Bless your heart.
We were not, we just had some water in our basement was all. We didn't really, we were up on a hill, and we had a camper that we had, you know, a cook stove we could use, and we already had bought. When I heard it was gonna be bad, I sent my husband, and I said, okay, you need to get this many bags of ice, you need to do this, you know, and thank goodness he listened to me, because I was on a 24-hour call, you know, and I got home, and then the hurricane hit, and we had no water, no municipal water to the birth center for several weeks. We couldn't get to anybody's homes, you know, we couldn't do anything. So we were finding places to evacuate people to that were pregnant, and midwives that would accept them in different places.
Where was this at?
Asheville, North Carolina, 2024, yeah.
What year were you there to work again with, out of curiosity?
I was there the first time from 2016 to 2017, and then I went.
I missed you. I took one of my Jacksonville doula clients up to the Asheville Birth Center
Did you?
to deliver a breech vaginal, because the OB at the time was amazing who worked with the birth center up there.
Yeah, Dr.
She was
Ollendorf
great.
was one of them. Yeah, was it Bree Bolivar?
That sounds familiar. I can't
Yeah.
remember. I have the best picture of her in the OR with her hands just like this as the breech vaginal is being delivered.
Yeah.
It's beautiful. Yeah.
Yeah, there's some really good doctors, or there were. Mission Hospital, once HCA bought them out,
Yeah.
they ran off a whole bunch of the really good doctors. The doctors couldn't work underneath that administration. It was a tragedy.
Yeah.
But Asheville fights back. No, they're trying to get rid of all of that, so, yes, ma'am.
So when do you think you'd be able to do an NRP here?
It would depend on what your time frame was, and we would talk a little bit about kind of what your needs are, if you guys want to.
There's a bunch of us that all expire around the same time.
Yeah.
We always take it together, November.
We did it in
November.
Okay.
Our requirements are every section. So the need is we have to know all of NRP, even though
Yeah.
we can't practice.
Yes, exactly, yeah. We also teach how to put in an intraosseous needle to give fluid resuscitation and epinephrine to the babies. It's part of the algorithm we teach.
Yeah.
Even if you can't carry it or use it, I just want you guys to know about it. Because what you carry is what you carry. And I don't have any interest or
To know what you do with it.
to know what you do with it. Just like every other avenue of any anybody else's life. I am a free for whatever anybody wants to do girl. I'm just like, I just love you. I just want you to be equipped. You can take the nuggets of whatever sounds good to you. If it doesn't hit